Since it's the first meeting of the new year, I want to wish all of you the best in 2024. We have the good fortune tonight of having Greg Laden with us. He is the representative for Plymouth Indivisibles, and he's got a lot of experience and a lot of knowledge on the caucus and the delegate and convention process that he's going to share with us tonight. Actually, I received an invitation from Dave Garibaldi to attend the presentation that Greg gave in early December. It'll be the same type of thing that he's going to be talking about tonight. And I was really impressed with the presentation. I left with two main points that pertain to this meeting. The first is the amount of voting power that's concentrated within the delegate. And the second is the necessity of holding our candidates accountable and making sure they're solidly backing what we're advocating for and that they're voting for our values. We all know that to achieve health justice in Minnesota, it has to flow through the legal process. It has to go through the legislature and the governor, and we need to assure that that happens. The caucuses actually are going to start the end of February. So that's why we need to gear up for them and get prepared for them. And also, this affords us the opportunity to build on the legislative successes that we had in the 2023 session, where for the first time ever, a report was authorized to conduct a cost study of the Minnesota Health Plan. So we're going to encourage all of you to consider participating as delegates. As I said, the caucuses start the end of February, and I'll turn it over to Greg. There'll be 45 minutes of presentation, and then you all have 15 minutes at the end for Q&A. And I anticipate there will be some questions because this whole process can be a little bit confusing and complicated at times. Right. So go ahead, Greg.
Thanks very much, Ken. I appreciate it. And I want to say, first of all, thanks for coming. And I don't assume anyone has been to caucus before, but I bet a lot of people here have been to caucus before. So I apologize if some of it's a bit, but on the other hand, you were not at caucus 2 years ago because we didn't actually have, we had the process, but we didn't have the physical caucus because of the COVID emergency. So we're all a little bit rusty. Okay. But just to give a very rough overview, first of all, I'm going to step back for a moment and respond to something that Dave reminded me we should talk about a little bit. It's kind of a common question that comes up, and that is, if you have a representative that is not clearly in favor of universal single-payer health care, what do you do? And I just want to make very clear, not everyone here is necessarily a Democrat. I am. And I can promise you that the only way you're going to get universal single-payer health care is with a Democratic DFL trifecta in place. It's not going to happen otherwise. And if you can have a different opinion than me, but I'm assuming that that's true. Okay. And so when it comes down to it, when it comes down to who you're going to vote for, you're going to vote for a Democrat, even if they're not giving you what you want as far as this goes. That's our objective, is to help them get over that lump, but it's going to have to be, you're going to have to be, you might have to just do that. Another thing I want to say is, you know, I have been on various organizations in the process of endorsement and legislative action, and I've probably had a conversation about healthcare with half of the elected DFLers in legislature. And I can tell you that there's a lot of individuals. It's like gun control. If you want to vote, if you want to support a gun limiting, firearms limiting bill, you can't do that if you're in certain districts and get reelected. No matter what you want, you can't do it. And you think about that as being maybe a weakness, but it's not. It's democracy. Okay, that's how it actually works. And so you have to lead. You have to get your constituents to follow and come to you on those positions, but it doesn't happen because you want it. It happens because you work on it, and it might take some time. Okay, so there are going to be representatives that want to vote yes on single payer universal health care, but they can't say that out loud. Okay, one of our goals here is to get them to say it out loud, but we can't make them all say it out loud. We want to get anyone who's kind of iffy, because there's a few, what positions can a DFLer have? They could actually legitimately not like universal single payer healthcare. They might have a reason that they don't. They're wrong, but they might have that as an opinion. They might have that opinion that it should be what we do, but they are very happy to say it. They will come out and say, I want the Marty plan. I want the Marty bill in front of us, and I'm going to vote yes for it. Okay. Or they might be in the position where there's this weird in-between space, I think, where there are people who actually don't know they want it, and they believe that we can just make some changes to expand access to healthcare. You hear those phrases, right? We're going to expand access to healthcare. We're going to put aside some limitations of healthcare. I don't want to hear anybody say that. When you say that to me, there's only two explanations for that. One is you don't know what you're talking about, or you're afraid to say what you're afraid to say it. Okay, the people. So that's your constituency. The people who don't know what they're talking about, so they can find out what they should be thinking, or the people who know what they're talking about have decided politically they can't say it, and what you're doing is you're inviting them to come over and actually say it if they possibly can. Okay, that's our objective. Okay, and how do you do that? How do you get a House member, a person running for the Minnesota House? Because this year, every seat in the Minnesota House is up for election. The Senate is not, the House is. However, there will be at least one Senate race within this year as well. Anyone who's in SD 45 will be voting for a senator at some point. There will be special elections now and then. Okay, so how do you get that person to listen to you? Well, you can write them an email, you can call them up, you can go, and if they are your representative, you can get them by just contacting them and sitting down with them and talking to them. Okay, but they might not be elected yet. Also, we're also talking about candidates. Okay, we're talking about people who aren't in office, but they're running, and we want them to be running on this, at least have this on the panoply of things that they can say. When someone at an event says, what's your position on healthcare? They say, I support universal single payer healthcare. I support the Marty plan, something like that. We want to get them over that hump. Okay. So I guess I'm going to rephrase that middle ground I talked about. It's like people, like the analogy I like to use is electric cars. What do you think about electric cars? If your answer is the technology is not ready, you're wrong. You're just plain wrong. Okay. What about they're coal cars? They're just coal cars. They just burn coal. That's just wrong. You just don't know. Okay. And you can find out, and you can learn to not say the wrong thing. Okay. I think there are people who have that position in healthcare. They have a wrong position in healthcare because they don't really know. And they may be really knowledgeable about other stuff, which is not their area. Okay. And then there are those that aren't willing to say it out loud because they want to get reelected, and they believe that their constituents are not on their side on this. Okay. So how do you sit down and talk to them, and how do you get them to listen to you, and how do you influence them? And one way to do that, you can just do it because you're in their district, and you can go and talk to them, and that's fine. I recommend if you do that, bring people with you, 3 or 4 people in a room with, sitting with a legislator. They pay attention, so go ahead and do that. But this is the caucus season coming up. The caucus is on February 27th. It's part of the Minnesota caucus convention system. And you live in a precinct. Everyone lives in a precinct, and you can go to your precinct caucus, and you can volunteer or run to be a delegate. And in the vast majority of cases, there are more delegate slots available than there are people who want to do it. So all you have to do is say, I want to do it. When you do that, do not say, I want to be an alternate. Just be a delegate. Because there's not enough delegate slots. And if you say, I'll be an alternate, guess what? You're now a delegate. Because they'll just slot you in there, okay? So just be a delegate. If there's no delegate room, be an alternate. That's fine too, okay? Be a delegate, and if you have to run for it, make your argument to your fellow caucus goers that you should be the one to go, but that's not going to happen because there's more slots than there are delegates. And Now what happens is, in theory, you're on a list. Okay, anyone who's ever worked for a campaign knows about the list. It's a spreadsheet, it's got all the delegate names on it, and the candidates are going to contact the people on that list and say, are you with me? Now, if there's an incumbent who's unopposed, yeah, this isn't really going to happen. If there's an open seat, only one person's running for the endorsement, then it might not happen. But you're on that list. You have a right to a cup of coffee. It's like your constitutional right as a delegate is they got to buy you a cup of coffee or tea. They don't have to buy it. Maybe you have to pay for it. Don't buy them one because that's illegal. But you can you get the right to sit down and talk to them. Okay, and do it in person. In person matters a lot. Face to face, sit down with them and hand them any literature you have, tell them your story, whatever it is, and tell them what you want. Listen to them, they listen to you, you have a conversation. Okay, so our objective is to get a couple hundred people who are in this movement to sit down and talk with those House members and make sure that they know, or the candidates, and make sure that they know, I'm supporting you for your endorsement if you have made the public statement that you are supporting this position. And here's where it gets tricky. If you're not supporting the position, it doesn't mean you're opposing them. It means you're just not supporting them. You're not going to go vote for Joe Kennedy. Okay. You're still gonna vote for Democrat. You have to say this to them, let them wonder, but you're still going to do the right thing eventually. But you want to put some pressure on them with your conversation about that you are one of the delegates in their district, and that your support for them depends upon that candidate's taking this issue up and being serious about it. Now, this is another very distinctive thing: increasing access to health care. I kind of like the bill, but I can't say it out loud. I have constituents that are opposed to this. People tell me they don't want me. None of those are adequate. Telling you, I like the bill, I like the Marty bill, but not having it on their website or not making it as a public statement, that's not good enough. Okay, it's actually good. It is good to know that they say they'll vote for it, but they might be just telling you that, right? Or you might sincerely believe that they do support it, but they just don't want to say it out loud. That's okay. That's good for you to hear that. But it's not what you're asking for. You're asking for them to make the commitment out loud to go for it. Okay. And there's details about that process. We'll talk about it in a minute. But the point right now is, number one, the first thing that I want you to do is sign up with us. And the form is in the chat. It's been sent out by email to people that we sent out again. This is the form we have, and right now we have 29 people on this form who signed up to do what we're doing here. Okay, and they've each given us their House district and their Senate district and their congressional district and also the county. The next thing you need to do is go to the caucus and become a delegate. A couple important details there. It's on the 27th at 7 p.m. in your local zone. And an amazing number of people do the following. They go to the caucuses and they say, I want to be an election judge. I want to be a delegate. I want to help with the pre-convention planning. And then they scribble their email down and we can't read it. My daughter works for Hennepin County elections. They spend about 2 FTE weeks, 10 FTE days, running down the names of judges. People want to be judges who gave them information that was so crappy they couldn't find them. Because by statute or by the rules they follow, they have to look for the people who claim at caucuses they want to be an election judge. They have to go through that list first before they go to get their regular judges. And it takes them 2 FTEs, so taxpayer money, because people can't write their email down properly. And I think people scribble their email. I know I do. I scribble my email. I'm signing into an event. You can't read my email. Either you already have my email or I don't want to give it to you. Okay. But when you sign in to be a delegate, you've got to declare yourself. You've got to give an email that you respond to, a phone number you will answer, your name so that it can be read, and we can find you if you have your name is down there because we have a list of everybody. But make it easy to be found. Okay, so you're actually a delegate that they can locate. And then when you're at the caucus, there's a process that I'm sure all know about of, the party has a platform of ideals and positions, and the party platform is created by the average citizens who write resolutions and they submit them at caucuses. And then the resolutions percolate up through the system and get voted on in a couple of stages. Now, the idea that individuals can walk into a caucus and write a resolution and then it becomes a law someday is kind of naive, because what really happens is we need to see those resolutions in 3 or more congressional districts and a certain number of precincts. So the way it works is organizations or groups of people like us create a resolution and we all take copies of it and bring it to our caucuses. And right now I'm seeing people from CD 2, 3, 4, 5, 2, 3, 4, and 5. That's enough. But it's to get all more. We'll get more. We'll probably be able to add more to this. And so if everybody brings the resolutions to caucuses, they will percolate up and they will be voted on at the state level. And there's already something similar on the platform. We just want to strengthen it and make sure it stays in there. Okay. I would advise you. So the next thing I want you to do is bring the resolution to your caucus. Okay. I would advise you to not edit the resolution. Like, you might look at it and say, I prefer different wording. Fine. But that's nice to have that, but the resolution already exists. The resolution is going to be submitted like it is now to all these different groups. And then it gets, the people who work for your Senate district might get 5 or 6 of them, because like a bunch of us are in the same districts. They have to take those resolutions and make them into one. We don't make a different resolution for every typo or every change in the usage of words, right? It has to all be one, so that your scribblings might be really good. And go ahead and do it. If you really go ahead and add something, and if it's an improvement, it might be what gets through, but probably it'll just be ignored. Okay, so bring the resolution in, become a delegate, and then contact your House candidate. If there's more than one person running in your House district, contact all of them. Sit down and have that cup of coffee with every one of them, and tell them where your position is on universal health care. And I would say, tell them, when they say we should increase access, tell them, as I see in the chat, right? Lana saying access is not a good word. It's kind of a clue to what people think. And make the argument to them. And then what you're going to do is, now that you are a delegate, you're going to go forward to the Senate district. And the way it works is, at the Senate district convention, now you can run for delegate to go to the state convention and to go to the congressional district convention, and maybe even a national convention if you want. This gets more complicated. If you want to be a delegate, now you have to fight for it. The number of delegate slots that come out of the Senate district is smaller than the number of people who want to be a delegate. I'm going to give you a couple of hints now as to how to do that, but we're actually going to talk about that in a different way later. Okay. If you're on our list, I put the link in there for it in case anybody's shown up since then. I'll put it in again. What we'll do is we're going to sort these out by House district and by Senate district and congressional district, and we're going to examine each one. There are, I think, about 7 House members now that have said they're not running. So 7 seats have opened, about even between DFL and Republican. This is in the news. You'll see people like their hair catching on fire because of this, and it's like a big deal. It's not. It's totally normal for this to happen. Nothing unusual. The number is not unusual, and the individual people leaving mostly makes sense. They've been there for 35 years or whatever. But those are races that are different. What do you do in your House race? Right now, you've got a House person, let's say, who's an incumbent, and you assume they're running again. You think of a strategy as something they're not running. What do you do now? Who's running? Maybe you should run. Maybe you should find somebody to run. So so what the strategy is going to be after caucuses is going to be specific to each Senate district. And what we're going to do is send you a note. We have your email. We're going to send you a note saying what we think you should do and why. And then you can see if you buy our story or not and do that. Okay. But it's pretty much going to consist of going to the Senate District Convention. And when you're at the Senate District Convention, there will probably be a process called the Walking Subcaucus, which don't worry about the details. The really most important thing to know is when you go to caucuses, there are people there who are trained up, and their job is to make you comfortable and happy and make it easy for you. When you go to the Senate District Convention, it's the same. There are people who are there to make sure that you have a good time and that it's easy for you to do. So don't worry about it. But the way it's going to work is people, like there's 100 people in the room and they have 10 delegates they can select. So a group of 20 people, right? 200 people, 20 people, that's 10. 20 people get together in a group and pick a delegate among themselves. Okay. And the way you do that is you stand up and walk around and form groups. So somebody, one of you, will have a sign that says, among other things, healthcare, universal healthcare, single payer. You're going to stand up on a table or get someone else to stand up on a table and hold that in the air, and people will cluster around you. Okay. Now, you're going to have a sign that says the name of a presidential candidate. That's got to be on there. And then you might have another thing, like if you want, if your Senate candidate or your House district candidate might be on there, whatever. The rule is going to be to have a presidential candidate up there, or that one of the candidates running, by the way, is a guy named Uncommitted, so it can say Uncommitted, or it can say whatever one of the other official candidates are. I don't have the list. Biden's one of them, and then there's some others. It doesn't matter. You're going to have the healthcare sign up there. And then if the number is 10 people get to elect one delegate, and there's 14 in your group, 4 people are wasting their space. 4 people should branch off and go to another group. If there's 8, you can't have any. So people move around between groups until everybody's got the right number. And the multiples, in this case, of multiples of 10. It might be 7, it might be 11. Someone's going to tell you what that number is, the magic number. It's called the viability number. Okay. So the way to get to be a delegate, the very simple formula to get to be a delegate without any preparation is stand near the entranceway. And when your friend walks in, say to your friend, do you want to be a delegate? And your friend says yes. Then you say, I don't want you to be near me for the rest of the evening. Go away. And I'll stay away from you. If your friend says, no, I don't want to be a delegate, you say, stick with me like a honey on a bee on a honey or something. You stick with me because I want you to vote for me. And hopefully that was actually your friend and they say yes. And so the more organized way to do it, and we can help you with this, because if we have 4 or 5 people from the same district, we'll tell you. And you guys can meet up so not everybody has to go to the Senate District Convention. You don't all want to. Some of you have something else to do that day. Some of you just don't want to do it, and some of you do want to do it. So among ourselves, there'll be a small number of people, a slingshot, a third person. So if the viability number is 8, you only need like 3 people plus you, because someone else will vote for you. A random person will vote for you, and then your friends will vote for you, and you'll vote for you. Okay, so that's how you get to go on to the next level. Okay, and the next level is the state and congressional. Stepping back a little bit, going back to the resolutions, you're going to submit a resolution at the precinct caucus. Then at the Senate District Convention, there will be a list of resolutions that someone has put together, and you get to vote on those. And the way you get to vote on them is you vote for everyone you like. Skipping one does not give anyone else an advantage. Just vote for everyone you like. You can vote yes on every single one if you want. Okay. So find the healthcare resolution on there and vote yes on it. If there's a affordable one on there, maybe don't vote yes on that one. You can do whatever you want, but find the resolution you want to vote on it. And if you really want to take this to the next level, some of you may not want to do this because it's a public thing. Some of you may be raring to do it. but you get, depending on the district, and it depends on each district, is different, but you will get to speak in favor of or in opposition to a resolution. The number of minutes you can speak is limited, like really short, 90 seconds, maybe. Again, every place will have their own rules. And the number of speakers is limited. When they run out of time, anybody in line doesn't get to speak. Okay, so you want to get yourself near the front of the line. But you want to have, if there's 2 or 3 of you, you want to have someone else farther back of the line. Because Dave gets up and says, I support universal single payer healthcare because blah, blah, blah. He's got a little pitch. And then some other person gets up and says, I don't want to be like England. My cousin lives there and they took 9 months to get their appendix out and then they died. You know, and then you got to be behind that person saying, this is not the system they have in England. That's different. Obviously, we do it differently. It's not the same thing. It's not national health care, and we're better, and blah, blah, blah. You have your answer, okay? And you all know the problems, right? You all know the complaints people make, and you all know the answers. And you can even just be, if you don't know the technical reason, don't worry. Just say, I've read about this, and I feel that I need to support this for the health of my family. Something like that. You don't have to argue the point. Just say, I'm a citizen, I'm for it. That's all you need. Okay. So maybe if you can be prepared again, if there's 3 or 4 of you go into one district, will be organized. Have somebody up near the front of the line, have somebody back in the back of the line. If you then also go to this state convention, we do not have we don't have a gubernatorial or constitutional elections this year. The state convention is not going to be a big convention, but there will be consideration of platform items for the resolutions. So this group of people has to send some people to the state convention to defend the resolutions there. The way it works in the state is a resolution is just voted on just like anything else. You're going to go there and vote on them. But there's another thing that happened to the state that is really obnoxious. You say, I would like to consider a resolution. The word usually uses pull, a resolution. So you take, I want to consider the healthcare resolution. And no one can say why or anything else. You're not allowed to use any more words out of your mouth. Well, turn the mic on. All you can say. And then they pull the resolution. And then they can vote on the resolution. There may be discussion, there may not be discussion about the resolution, and then people can vote on it or not. The only reason to pull a resolution is to kill it. Okay, so someone's going to try to kill the resolution by pulling it and then arguing against it. So you got to have people that are ready to argue in favor of it. 3 people will be able to say something negative. 3 people will be able to say something positive. Somebody will get up and say, I'm saying something positive. And then what they'll say is, I want us to be just like England, where my cousin died from appendicitis. So in other words, people will cheat. Okay, so you don't have to worry about that. The people going to the state convention will organize and get trained and figure out what to do and get strategy going. And it may well be, and I have confidence, that people are not going to try to kill this resolution at the state level. Because you know why? Everybody wants it. And I guess one of the main things we're doing here philosophically is recognizing the fact that everyone wants this, but many of our elected officials are afraid of it. And we're trying to push them over that deficit. Okay, so I'm going to give this, now we have 2 documents, and we're going to send them around to people, right? For people to see, but this is just what I just went over. So the idea is to attend the caucus February 27th, 7 p.m., and then meet with your candidates and tell them your commitment to this, and don't commit to them if not. They have a spreadsheet of delegates. You're one of the delegates in the spreadsheet. They want to put your name in their column. Only do it if they not only tell you that they like it, but have made a public statement about it. Okay. Prior to the convention, we will get in touch with you. We're going to help you figure out where to go. You might make a sign. You might work out a resolution support plan among your people. Again, we're going to give you some more instructions and help you find each other. Okay. And at the convention, you might be submitting a question on Universal, because if there are candidates running against each other, there's a question and answer period. Okay. Several of us are there. We can all submit similar questions, so they'll get asked for sure. Hold up a sign. Use it for your walking sub caucus. If you like a candidate that's already done this and said yes, have their name on that sign. If not, don't have their name on the sign. Okay. And then you're going to have your plan for getting elected. You're going to support the resolution. And this is one that's a bit more controversial. But and it might not work. It might have no purpose whatsoever. But if there's not a preferred candidate when it comes time to voting, don't vote for him. Just vote no endorsement. Now, that might not do anything. So what'll happen is one candidate will win, one candidate will lose, and then there'll be some no endorsements. As soon as that candidate wins, they don't ever announce the numbers. They normally don't announce the numbers. And the losing candidate comes out and says, I'm not running anymore. I'm going to support the other candidate. It's a little ritual that happens. But it's possible for the no endorsement numbers to be known. And inside, people will know the no endorsement numbers. It will be known to somebody. So having no endorsement numbers on there is just a way of saying, I didn't like what happened here. Okay. Later, the candidate that runs, you got to support him, because they're not the Republican. But you don't have to, you can support, you can put your political efforts into wherever you want. It might be somewhere else. The Congressional District Convention is the same process, but there's no resolution at the CD convention. And the same, there's a question and answer period normally. You vote for the preferred candidate. I mentioned, yeah, okay, so that's going to happen. And then the state convention, same thing. Now, at the state convention, I recommend this organization gets together some literature, and you can usually get a bunch of people in there, and you can pass it around so every delegate gets your literature. And that's another way of just getting information out. You're going to be sitting at a table with a bunch of people from your area, and you can be talking up you can have your buttons on, your healthcare buttons on. You can talk up your strategy. Okay. And then when we hand out this document, it's got this long, I realize there's all these words that aren't defined, so I defined them all. That's basically it there. And then just to remind everyone, please sign up for this. And that way we can, if you haven't already, and that way we can get your name on the list. And we'll sit down and again, we'll look at each Senate district. Just to be clear, for most people, you live in a House district. There's 2 House candidates in your Senate district, but you live in one House district, that's your candidate. So you're going to have a mini convention within your Senate district convention to elect your House endorsement. You can only vote for your own House person. So you split the convention into 2 parts. Maybe do one while people take a break, do the other. Maybe they put you in 2 different rooms. But you're at a Senate district convention endorsing House candidates. Okay. The other thing you can do is, if you want and get organized to do this, you can table at these conventions. You can table at the caucuses, and you can table sometimes. The rule in the DFL is local rule, right? So some caucuses allow tabling. Mine does, 42. I'm in charge of tabling. Please table in 42 if you want. Although we're going to charge you $20. It's a fundraising thing. And you can table at the state convention, at the Senate conventions. Tabling at the state convention is a different deal. It could be pretty spectacular. It costs money. If you got several $100s, consider it. You can have a banner hanging over the delegates in the middle of the stadium, or whatever it is, wherever they hold it. You can have a giant sign somewhere. You can certainly have a table in the tabling area with your people at it. It all costs money. It's all worth it. If you have the cash, it's the tabling is worth it. The banners overhead may or may not be worth it. Unions buy them. They're expensive. Unions will buy them, and they'll have AFL-CIO banners. I've had DFL Environmental Caucus bought one once. And then you have a banner. I think you get to own the banner. Anyway, tabling at the caucuses, maybe. Tabling at the Senate district conventions, definitely. Tabling at the state convention might be worth it this year, might not be worth it this year. You're speaking to other Democrats. It's not going to be a big convention. It won't be cheap. Okay. So that's the plan. So now we should have a little discussion or questions. Is there a way to get an estimate of how many people have been a Senate district but before? Just show of hands. Okay, so a bunch of people have done this before. Good. Linda, you have a question or comment?
Yes, I would like to mention the value of volunteering to be on the resolutions committee at the local level for sure, because in my district, they really are aggressive at trying to combine several resolutions together and kind of smooth them out and neutralize them a little bit. And so to keep the wording that we want on our resolution, I think we need to advocate for that by volunteering to be on the resolutions committee within our own districts.
Good point. And I agree with you. And specifically this resolution, it might end up becoming an access resolution. Right? There's an access resolution and there's a universal resolution, and someone says, let's combine them. One or the other is good, something like that. They might combine them and mess them up. The way you get on the resolutions committee is at your caucus, you sign up for a pre-convention committee. And then you sign up for the resolutions committee on the pre-convention committee. We do have a good situation with the resolutions. Definitely sign up for it. But the resolutions committee at the state level is chaired by somebody who's very, very much on our side, Phil Laden. He wants this to happen. So he's gonna, and I'm gonna help him with that too. So I'm also gonna help him my state committee, my Senate district committee. We're not gonna allow this resolution to be watered down at the state level, but in the in-between levels it might get, and you might end up with alternative competing resolutions that will confuse people. Ken, did you have a question?
Well, question and a comment. In all my years of being part of the DFL, the last 45 or whatever, and that the way it works is the resolutions come from the precinct caucuses to the Senate district organizing unit, and usually when they're put together, they end up being put on a ballot to vote on.
Right.
Numerous districts only allow 200 resolutions on that ballot, so in the interest of trying to keep your resolution the same, you want to try and get it to as many precinct caucuses, or get as many precinct caucuses to pass it on as you can in the wording that you've got, which will help you to retain the language that you got. Beyond that, I do think that resolutions get voted on at the next level, unless they've changed that drastically as it goes up from there. Senate district, congressional district, the state convention, you'll be voting on at the most probably 200 at the state convention. And the one thing that you have to remember is that you have to decide whether it's a new issue or if it's a modification to the continuing party platform. So you want to make sure that those issues are there also. So
yeah, they'll be voted for on the state convention for sure, and this will probably be an action agenda, because the action agenda and the party platform, and we want the action agenda to have this on it. And yeah, so that a good point, a really key point Ken mentions here is that this is one reason not to change the language. So you change the language in yours, and your friend who's in the next precinct room over doesn't, you've never got two resolutions. So if there is some issue of how many resolutions fit, you've just created crowding for no reason. So just don't do that. And also the number being allowed in the states expanded. There used to be a more limited number, literally because the machine counted only so many votes, and that they got a new machine. So they're going to be expanding that number a bit. So that shouldn't be a problem. Sharon, I think, was next. You need to unmute. Yeah.
Is our wording going to be similar to what's already in, whatever you call it, the resolutions from last year or the year before?
Dave, do you have a copy of that? Or do you know the answer to that? It's not the same.
Yes, I was heavily involved in writing it.
Yeah,
So,
Dave basically wrote the resolution.
and it will be dispersed to everybody who is at this meeting, I would assume.
Yeah, so it's similar, but updated and different. Yeah. Anne?
Which convention selects the state convention delegates? Do you have to make it to your congressional district?
No, that's a side branch. So the Senate District Convention
Senate
selects the
district
state.
goes to the state. Okay, I think
Yeah.
that's important for people to know,
Yeah.
because that's probably a little easier. It's your
Yeah.
Senate district, which could also be a county convention or an organizing unit convention, right?
Right, except it's
Yeah.
going to be an organizing unit convention organized for the Senate will do the
Okay,
the state.
okay, it's a little, the
Yeah.
layers in the party business are a little difficult. Also, Greg, do you have hints on how we can get, now Dave and Don are going to be crafting a resolution, single payer financing for healthcare has been on the DFL party platform forever. That's not, and it hasn't moved anything.
Right.
So we're going to craft something that's more action oriented.
Right.
And then how do we get this issue on the DFL party action agenda?
By passing the resolution through this process.
Right, but that doesn't automatically get you to an action agenda. That's a pared down,
Right.
20 top issues.
Right. And that's it's got to get the votes at the state convention.
Are there separate votes for action agenda versus just platform?
I'm not sure what they're doing this year because they've changed the rules slightly, and I
Okay.
don't know what the
Okay.
exact rules are going to be, but
Because I didn't know about this action
Yeah.
agenda versus party
Yeah.
platform until very recently, and I think that might be new information for people.
right. Yeah, and we have pretty much infiltrated the process enough that I think we're going to get it on the action agenda. If enough
Okay.
people vote for it.
Okay. And actually,
Yeah, go ahead.
Ken Martin said to me last summer at Farm Fest that he thinks timing is good.
Yeah.
Single payer fine. So we may have a little bit more support with the party than previously, but we still need to get them to put resources into this.
Yeah, and you know what? The political wonks in the party, the people who are not the candidates or the electeds, they're on board with this. It's the people who are not on board are the DFLers who are afraid of losing votes because they say it out loud. That's it.
Okay.
And
Yeah.
yeah. So that's who we're really working on here. I have confidence that we're going to get this on the action agenda as we need
Okay.
it to be. Yeah.
All right. All right, good.
So I think Linda was next.
Yeah, thank you. I just, one clarification on the delegates is that at the Senate or county, OUs or county units, whatever. I'm in a Senate district, so I get mixed up with the others. But the delegates that are elected to the state convention, there are also the delegates to the congressional convention.
Right.
They're the same. So that was one thing. I wanted to mention that in the past, when I have lobbied, at the state convention, I've been delegate to the state convention different times. And what I've observed is that a lot of people, there's a given number of people who don't even look at the resolutions list. They don't vote on them, or maybe they vote on, 1 through 10, but there's 150 that could be voted on. They don't take the time. And so I learned that, and you don't get to see that list of resolutions to vote on before you get to the convention. And so I took some just poster board and markers along last time, and the resolutions that I was advocating for, I put those big numbers, vote for resolution 51. And I put those on a board, and I would carry them around, and I would talk to people about them. And the resolutions that I advocated for passed. And I think it was simply because people thought, oh yeah, she wanted that,
Right.
I mean, they read it or not. But lobbying for your specific number on the resolution helps get the votes.
Yeah, do that lobbying with the group you're sitting with. Wander around the room and talk to people. But also, this organization could possibly get a half pager that a bunch of volunteers can get out a hint to every single person at the convention. If you want. And that says the resolution number and what to do with it, for sure. Okay, Sharon?
Yeah, I had never heard of the action agenda either. So, I'm wondering what it means. Does it mean that that's what they're gonna act on in the legislature? Because most of the time, I've talked to many senators and representatives, and they have no idea what's in the resolutions.
Okay,
So
a couple things. One thing is, first of all, over the years, the platform and resolutions committee and the community has gotten more aggressive and more power in the DFL. So the DFL now has a restructured way of presenting their platform, which includes 4 or 5 major statements that then the various platform items are divided up into. And the last year, the committee worked out a plan which they didn't implement last cycle. They didn't implement fully, but it's just a trial run. But the idea is to take the committee. A lot of this has to do with committee works, right? So you take the committee, you take the resolutions and match them to committees. Okay, in the state, the House and the Senate, and put together a presentation, basically the subset of resolutions that committee relates to, and there'll be more than one. There'll be many different matches between resolutions and committees, but every committee gets a hand-delivered package that says this is what the people of the DFL are asking you to do, and it goes to the DFL leadership in every committee. And that the last year happened only in a couple of areas, but this year is going to happen, I think, in more areas. But you, as a lobbyist or as an individual who has you have your representative, you can walk in and say that the purpose of the list is for us to use it and go and point that out to them, Sharon. It's like, see, this is what we all voted for. What are you doing about it? And there's no provision whereby the legislature is issued a list or is told to look at this list or uses this list. There's no provision for that whatsoever. That's what we have to do. So we have to make that next step in connection. Some legislators, I'm sure, pay close attention to it, but most, yeah, there's no. It's really busy. Follow a House member around for a day during the session, and you will get tired out before they do. On the 15th hour, you'll go home and they're still there. Okay, there's no looking up resolutions. There's no place for that. So we have to insert that when we go and sit down and have our lobby day or whatever and talk to them. You point out it isn't just me who wants this. The party voted for this.
okay, so what is the action agenda? What does that mean?
It's a subset of resolutions that we want the legislature to act on now. Whereas the party platform is
We meaning the people, not the DFL leaders, or like Ken Martin, or I'm just wondering,
yeah.
it's at our level and our responsibility.
It's our level, which means it's the top level, because the DFL is run by the convention. The delegates are in charge of the DFL. Okay, everybody else works for the delegates.
You may think
No, it's really
that.
true, honest.
No, it isn't, because I know that some things have been stopped.
Oh, yeah.
At not by us,
Right.
by.
Absolutely, and that's why we have to fight, and that's why we have to go to the state convention, to protect these things. And one way to protect them, of course, is to remind people who's in charge, right? By showing up. So that's what we got to do. But the action agenda, the platform tends to be more overarching things. We believe that everyone should have blah blah blah, and the action agenda is, look at this particular issue this year, get a bill passed, whatever. So it's more immediate. But it is as much part of the grassroots process as endorsing candidates is. But it has historically been disrespected. I remember going to two of us who were kind of long-term DFLers that went to a training that was being done in our district by an organization, and this young whippersnapper up there was talking about the endorsement process. Then he got to the resolution and said, nobody pays attention to resolutions. So my colleague and I stood up and asked the guy to leave. And then we explained resolutions and got everybody involved in it. But they have gone, the resolutions have gone. We have to remember that our concept, our perception of how things work is always a little bit behind how things really are. Okay. And sometimes we're not seeing bad things developing, and sometimes we're not seeing good things developing. And the resolutions process is getting more and more central, more and more protected, more and more realistic, more and more valuable, and more used by activists when they talk to their representatives. And the representatives are more and more taking heed of them than they used to be. So I hope people are a bit positive about them and hopeful that they will be used, but they're only going to be used, like you said, the delegates are in charge, but there are forces that take over and kick you aside. So we got to stand up and stand our ground on these resolutions to make that work. But what they are is something we've all agreed to. How many times do you get into a conversation about healthcare and it goes off into admiring the problem and details and stupid stuff? And that's not what I said. The resolution is a document that we voted on. It's like the Constitution. There it is. No matter how far afield the conversation goes, this is the resolution. This is what we want. This is what we've agreed to through a process with thousands of people involved in it. So.
Okay, well, I know this group will eventually know which 5 resolutions, from what I'm understanding, will be supporting about 5 of them.
I think we're
Top
supporting.
5.
I only know of 1. There's 3. Why are there 3? Well, there's only 1 resolution about universal health care, right?
Okay, so that's the only one.
And that's another thing, by the way. My position on this is I don't care about anything. I care about nothing but universal single payer health care.
Okay, so it doesn't
Nothing.
matter if it makes the top 5.
Oh, it matters a lot. We want the universal health care resolution to be voted for. And by the way, where it stands in that vote is important to me. I want it to be number 1 or 2 or 3. I want it to not just be it got over the line. I want it to be the one everyone wanted. Right? So
Okay.
that's what we want. And I don't know about your other ones. I don't care about them. I only care about this one. I'm focused on this one thing. So Ann, did you have a comment? You got to turn off your mute. And you're muted.
Oh, Dave was ahead of me. And
Oh, sorry.
Sharon, your
Okay.
hand is still up.
So Dave, do you want to go then?
Yeah, I just wanted to, since we couldn't really look at this. I did send it to Ken a few minutes before the thing, but I've really been working on this since I'm just wrung out as long as I've been working on this thing. But here's the first sentence, just as a teaser. The DFL prioritizes and commits significant resources for a campaign to promote legislation for a patient-centered healthcare system by enacting the Minnesota Health Plan by John Marty at the state level and the Medicare for All Act of 2023 at the national level by Jayapal. So that's the opening statement. I don't think we've ever had an opening statement like that where we are demanding that the DFL commit significant resources
Right.
to this campaign.
Good. Okay. Ann?
And I was just going to let people know that our Healthcare for All Minnesota Organizing and Base Building Committee, which is the committee responsible for doing all the outreach and individual base building to support a universal single payer healthcare system in Minnesota, is looking at a course, and we want to put it out there that we want to be tabling at the Senate district and the congressional district and the state convention. Let's say, we have to be really careful with our funds. So if the state convention costs a lot of money to table, we may be looking for people who, if you're not a delegate and busy with convention duties, maybe you'd be willing to go up to Duluth and be circulating with information. If we don't specifically table, we could find ways to arm you with literature and buttons, and that might be how we'd have to handle it if it costs too much money to actually table at the state convention.
Yeah.
So,
And you should absolutely do that anyway. But the
Yeah.
other thing you can do is you could also table with someone else, split the cost.
yeah, that's a possibility. Yeah. Well, I mean,
So-
got a little time, just so you know, the state convention, I think, is May 31st, June 1st and 2nd.
Yeah, and it may early June, you're
Yeah,
right.
it's pretty easy to table at the state convention, or the Senate district and the congressional district. And
Yeah.
maybe the county convention if you have commissioners up for election. We've done that before. So yeah, so everybody on the call, if you know your own particular local area, please let us know that you're willing to staff it, because our committee can't staff everything.
Yeah.
If you can staff your own Senate district convention and congressional district convention. And then I think it might work out that if we want you to be delegates so you can push this issue, but also if you're not a delegate, there's still a role for you. You could still push our issue by being, somebody who could circulate or staff a table.
Right, and any of those levels. And also, by the way, you might, in terms of who to table with, think about the two that come to mind for me right now are the rural caucus for the DFL.
Oh, right, good,
And
good point.
the progressive caucus of DFL. The progressive
Okay.
caucus is really big on this.
DFL,
I was going to ask the progressive caucus to make universal healthcare a litmus test in the endorsement process, but
mhm.
I never got that idea out in time for it to be part of that. But I think it more or less is anyway. So, yeah.
Okay, good hints.
Jerry, you're in CD8. I
Me?
didn't realize we had no Jerry. Looking at Jerry up here asking.
Oh, yeah, Jerry.
Something my dad taught me a long time ago is you need a second on a lot of motions. And he always said, never go to a meeting without bringing your second. So if you think that you're going to go into a environment where you might get shut down because you make there's a motion and you don't get a second, you get shut down. All you need, they don't have to be a delegate. They don't have to do anything. They just have to be your second when you bring up something so that you can have an opportunity to speak. So always bring a second.
Yeah, actually, they do have to be delegate though. At our meetings, you have to be a delegate to make a motion or a second, but
Not at the precinct caucus level.
no, not at the precinct caucus, right? You just show up. All you have to do is
Point out, but that's the starting point. Is
Right.
you get
That's
shut down.
right. Yeah, and that's a good idea. I mean, if you have, it can be worked this way. Just think about what you need to do to convince a bunch of people to do something. There's 11, 12 people in the room, maybe 20 people in the room. Bring a few copies of this resolution and hand them around. I saw the nurses union do this one year. They were amazing. They had 2 resolutions. They showed up in every single caucus in the state of Minnesota. And they handed out to every single person this piece of paper, these two resolutions on it, and a little literature. And they were a nurse, so people listen to nurses, right? Nurses know how to make you listen to them. They're like teachers, and they just, it was easy. They didn't have to read the resolutions. People just, yes, we vote for this. It was something about requirements, regulatory requirements for making it so that nurses could use machineries to move patients. Nurses were getting injured from moving patients, and they wanted to regulate hospitals to require this other thing, and then some other thing. But you can do that. Have a couple of people with you. That's absolutely right. And there's like, oh yeah, I want to vote for that, and just get that little excitement going and just get it done. Yeah.
So Ken or Greg, there's a couple things in the chat that I'd like to point out. First of all, there's a request for documents. So if you would share with Judy the document that you projected for us, and then also the resolution that Dave Garibaldi worked so hard on. If we could share that with everybody in attendance at this meeting, that'd be really helpful.
Yeah. So
And
Judy, do you have a link to that document already?
She's saying no.
No, sorry, I was moving my mouse. No, I don't.
I've got
You got it, Dave? So Dave can give it to you, and Dave can give you the resolution when it's ready.
Okay. Yeah, the resolution and what you projected, Greg.
Yeah.
Then there's a go ahead.
I just noticed that we now are up to 38 people on our list. So people here are signing up. I appreciate that.
Yeah, that's great. Wonderful. There's a question too. Is there a plan for a mock walking sub-caucus for training purposes?
Yeah. So what we can do is once people are delegates, we're not going to need this before the caucus, right? We can do this after the caucus, and when we have a list of who's doing this, and we can have a couple different sessions. It's, I'm not sure, I mean, to do a mock one, there's a few ways to do this. One is there's actually videos that show how it's done. Some of them are cartoons, some of them are people. DFL has produced some. I think they're going to produce some new ones over the next week or two. They're going to come up with a new one or two on the process. So we can look at those resources, and we could definitely have a meeting or two. It depends on what people want, but we can definitely do that.
Okay, very good. And then one last thing I want to address is Ken McGinnis put in a comment toward the end of the chat, and I don't know if you want to put a comment on that, please react to that, Greg.
It's just all I put in, Kenny, was the language from the call. It explains what the action agenda, how that gets there. It's got to have 60% affirmative vote, and
Right.
there's only 100 items that can be approved to do that. So
right, the final group list is 100 items, but the number of items there used to be a limit on the number of items that could be on the ballot, and that's been relaxed. Yeah, and I think that's probably current. Yeah.
Any other questions or comments? Dave?
Okay, I've got a link here, but I'm going to expose my lack of tech savviness. It's a PDF link. Will that automatically get everybody to that PDF? Or is it just on my computer?
It won't get people to your computer.
Will it get people to the PDF?
Maybe.
Is that impossible, or?
I don't think so. Just email it to me, Dave, and I'll email it out to the entire list of people that signed up.
All right, I did send it to Ken. Ken, it's in your email right now, so.
Thank you, Dave.
I will get it to you, Judy. And a couple quick comments, because I've heard Greg give this before, and I don't think he said it tonight, but between the caucus and the Senate district convention, if you're going to be a delegate, you got to answer your phone.
Yeah, I did say it in the beginning.
Because I don't ever answer my phone unless I know who it is. That's going to be something hard for me to do, but it's going to be a candidate calling, and I know from past experience, I've just accidentally answered my phone during the campaign season. Sure enough, there's a candidate.
Right.
So remember, and do we consider bringing up a resolution? You said if they consider a resolution at the state, it's usually because somebody wants to get rid of it. Do we ever want to bring it up to promote it?
No, never.
Okay.
Never. Bringing it out exposes it to voting it and to its non-existence.
Okay.
Yeah. Yeah.
What is the website where we can find the schedule of these various caucuses and conventions? Can you provide that for us?
Not available yet.
Oh, okay.
But it will be any day now.
Okay.
And the other thing that's not available yet, but will be available any day now, is a way for you to find your precinct, the precinct caucus finder, which might be because you might have gone to caucus last time, but it wasn't really in person. And the previous time, it was before redistricting.
Mhm.
So the precinct finder will be available by somebody. Will make it available around February 1st, I think, or maybe as late as February 10th. So that anybody who's on this list, we can make sure we send out the precinct caucus finder. And what I want to do is take everybody on this list, basically make a subset of Senate districts, and write an email that says, here's your precinct caucus finder, here's where your Senate district is going to be, here's the House district candidates that are up, here's what we think about what's going on there, like do you have multiple candidates or not, whatever analysis we have of that House district that you're in, and send it to everybody on the list that's in that House district. So anything you guys think of that we want to also make sure people get, let's coordinate on that and make sure everybody gets like that information in that email.
So your Senate district or your organizing unit plans the caucuses. The caucus is the same for everybody, February 27th,
Right,
Democrat, Republican, other. And then after that, the Senate district convention is different and it's in the next couple months.
right.
At your caucus, your precinct caucus, if you agree to be a delegate or an alternate, they will give you a piece of paper that tells you the date of the Senate district convention and location.
They should do that.
They should do that. So yeah, I've been a caucus convener a few times. It's
Yeah.
chaos, but we try to make it, clear. And then the next level convention should tell you the next date.
Right,
Those are all planned at that local party level.
right.
Senate district or organizing unit.
Yeah, exactly. And that'll be what happens. So you have to be given a notice. Legally, you have to be given a notice of the convention.
Mhm.
And it might be just a piece of paper you get at the caucus.
It'll get a little scrap of paper that says you agreed to show up at.
Right, yeah. Ken?
Just I put the link in the chat for the DFL call. It gives you all the dates and the information that you need to know about the upcoming conventions. Doesn't list the precinct caucuses because they're not there yet, but Senate districts, some of them may be there, but it gives you the dates, get elected from one
Yeah.
unit to the next unit. Okay.
Right. And they should all be known by now,
And
but
it-
we're not all on the list yet. Yeah. Sorry.
Did you have a question, Dave? Dave, your hand is up. I'm just wanting to make sure your question was addressed.
No, I don't have one. Sorry about that.
Okay. Any other questions or comments for Greg? It sounds like we've really had a fantastic response to filling out that form. So thank you all for doing that. And if you have not yet filled out the form, please give it strong consideration. We really need a lot of delegates to show up and get this going. So please participate in this process. Anybody want to say anything before we adjourn? Thank you very much, Greg, for giving this presentation.
I want to thank everybody for doing this. That's what's important. And for everything else you're doing. And just so you know, this is a little pitch I always give this year. There is a blue wall. You'd have heard of the blue wall. Pennsylvania, Michigan, Wisconsin, Minnesota. Even though Minnesota has reliably voted for Democrat, we're D+1 only. We're barely there. Trump won because the blue wall broke that year. Okay. We have a trifecta that is delicate. And we have an open seat in CD3. A lot of you are in CD, some of you are in CD3. So if you're a Republican who's anti-healthcare and you want to focus your energy, where are you going to put it? You're going to put it in Minnesota. You're going to put it in the CD3 and CD4. A few other places. You might be in a district which is actually being targeted seriously. So this is a year where activism and voting and getting people to vote and getting people involved is important. And this is a test. This is what Ken Martin said at our last state meeting. The legislature did a lot of progressive, bold things. We're now going to find out how stupid we were or how smart we were in this election. Did we go too far or not? And if we went too far and we are punished, healthcare is in serious trouble. Okay. But if we didn't, healthcare is a breeze. Look at all the stuff that was done last time. And healthcare should have happened last time. Okay, right? But it wasn't ready, I guess, in some ways. But we have to move the needle forward and make it ready by making it normal and expected for everybody in office to say yes. That's what we want. To say it out loud. That could be our motto. Okay. So thanks very much. I'm going to take off and make dinner. And I'm looking for more people signing up here. You'll all be hearing from us. Cheers.
Thanks, everybody.
Thanks.
Have a good night.